So I'm having a chat with Health and Social Care Minister David Ashford. This is recorded on Monday. We didn't see you last Friday at the press conference, and you've been on a stick. What's wrong with you, first of all? Let's clear this up. Are you suffering from anything severe? What?
Nothing to be panicking about, Paul.
Okay.
I'm not going to fall over during the interview or anything like that.
It was you and Mrs. Barber on sticks.
I've got a large cyst internally on the back of my kneecap that's about 8 inches tall and 8 centimetres, I should say.
Wow, yeah.
8 centimetres tall and 5 centimetres deep. But
sounds
it's nothing.
painful, though.
Believe it or not, it's not actually that sore. It causes twinges occasionally. So people will be seeing me hobbling around a bit over the next few weeks. In health, we just call it mystery shopping, to be perfectly honest. But no, it's nothing for anyone to be concerned about. That I was asked to take some rest, hence me missing Friday's press briefing.
Well, we should,
and the joys of you guys.
Thank you. I love the return. We should ask how the Chief Minister is, because he was coughing and spluttering, as I had to point out. I mean, he said it himself. He said he got man flu, right?
Well, yes. I mean, the Chief Minister has had a cold for several days. Right. He's absolutely fine. I've been speaking to him today. In fact, I've just come from an event with the Chief Minister. Absolutely fine.
Self-isolate, keep out of circulation, nothing like that?
Well, it's a good chance to repeat the messages actually around Covid-19 and the symptoms, because we don't want people overreacting as well. If someone is coughing, it's a new continuous cough is one of the symptoms of COVID. It's a very dry cough, and also, of course, a temperature generally as well. What we don't want as we move into the winter period is people reacting to people simply because they might sneeze on an occasion or they might cough on an occasion. It's important that these things are measured. He is alive.
He's got no antibodies. He kept saying.
He is alive and well, Paul, and I'm sure he'll be delighted you're so concerned. I
am. Let's now deal with some real stuff, because this is where we get more chance to talk. These two questions things and doing it on Zoom is just not. Anyway, another day. This Dr. Glover business, what's going on there? She's got this. She's very medically into all this stuff. She's given advice to you in the past, and there's definite tensions going on. Does that exist with you as well? And why are you not listening to her?
No, I don't have any tensions with Rachel as far as I'm concerned, unless she certainly hasn't told me about them. If I have, I mean, she's highly qualified. She's a very intelligent individual, and she's very, she's very well qualified for the job that she does.
Why not listen to her?
Well, we are. I mean, I've met with Rachel Glover. She has had feed input, but she's not employed by the Department of Health as such. She's a contractor working for DHSC. Government has governance structures in place. So one of the things we've got to remember as well is when we look at things like testing, it's not just pure testing we're looking at. We're looking at the economic impact of any decisions we make. We're looking at the social impact of any decisions we're making. Within DHSC, the swabs don't do themselves. I've got to consider as Minister, how are we going to, it's all very well talking about mass testing, but how are we going to actually implement that and staff it up while trying to run day-to-day healthcare, which is what the people of the island want as well. I don't think the people of the island would be too happy with me if I started suspending elective surgery to pull people off to man the swabbing team again at this current stage. But there's a lot of things me and Dr. Glover fully agree on.
You have seen the tweets, right?
I have indeed.
Dissed by the Chief Minister, I think, or something.
I mean, the one thing I started disagreeing, I watched Friday's press conference, and I don't think the Chief Minister did dish her as such. Certainly, the press conference I watched, because of course I wasn't physically there, the Chief Minister stated that we had a highly qualified Director of Public Health to his left, as he was saying, and Henrietta spoke about the governance systems in place where reports will come through to Council of Ministers, but ultimately are presented by the Chief Officer responsible, because they hold ultimate responsibility to Council of Ministers. But we have our own health professionals in health. Dr. Glover is a contractor. If microbiology wishes her to have input into papers, then they will do so. But it would be out of the ordinary for us to involve contractors in day-to-day decision making. We don't make decisions off the opinion of one person, no matter how qualified. We make it off an overall balance of evidence.
But if she sent you something, you would pay attention to it?
Yes, and she has. Myself and Dr. Glover have met. She provided me actually with 3 very helpful papers that she drafted up, 3 very good papers, I must say. And I think, as I mentioned at the press conference about 2 weeks ago, I think it was, and I'm happy to put put it on record again, you know, I am very thankful for the input she's had into microbiology. She's really helped us scale up our testing capacity, and without that help and assistance, certainly our testing facilities would not be where they are today. So I am very grateful to what Rachel's done.
Question 1 in Timble sitting went on for 31 minutes, wasn't it? And Henrietta was mentioning that and how we're doing things and the way it's being done. Any comment there? Because obviously you inputted, I think, on that. Yeah, you did, didn't you? Yes. I mean, a lot of, how do you put it, backbenchers are sort of chirping up here about the way things are being done and consultation. What do you think?
Yeah, well, the clinical leadership group is involved in decisions. The papers come via either public health or the clinical leadership group, or in some case they're joint papers that come from both of them. So all of our decisions are backed up by clinicians, but it comes again back to that phrase which I've used before, Paul, in one of our interviews, which is advisors advise, politicians decide. We live in a democracy and it's a government. It is not, the clinicians don't make the final decision. The politicians do, based on the evidence before them.
Sure. Well, I mean, the UK, we said we're being guided by the
and we are guided by.
Okay. Well, let's try this one. I mean, when you got rid of the 7 days with a test, and went back to the 14. Who told you to do that? Was that on medical advice, or was that purely a council minister says, we need to lock things down a bit more? How
no, we asked public health around, and the clinical leadership group for input around movement, but what the risk factor is. We have a risk table that says, obviously, 7 day in test is not 100%. It's about 96% accurate on a median level. So that still leaves potentially 4 to 6% risk in there. So, and obviously if you're coming from higher infected regions, the risk of someone coming back and being able to pass the test but still be infected obviously increases. So we use that to model out how many cases potentially could come off the back of that. And with the way the Northwest went, I mean, Liverpool alone, for instance, we've got to remember when we brought 7 day in test in, the infection rate per 100,000 was around about 70. When we reconsidered 7 day in test, it was around about 170, and since then it's gone up past 600. So it's absolutely spiking there, and that increases the risk to the island. But the other thing with 7 day in test we've got to remember is the whole purpose of it was of benefit to the individual. So they would pay £50 for the 7 day test, and after that they could have a modified self-isolation for the remaining 7 days. If we're going for the pure 14 days, which we had to do with the risk factor that was coming through the Northwest, and the fact we're still receiving isolation cases off the back of the infection rate in the Northwest, I think shows it was the right decision to make. Why would anyone want to pay for a test that doesn't actually change anything for them? And we also have to
people were there, weren't they?
Well, they weren't going to pay. But they were, things were changing for them. If we went for the strict 14 days, then 7 day in test becomes redundant. But again, it's something Dr. Glover raised in one of her tweets, which again I agree with, and I said I agreed with at the time.
What was the uptake like, by the way, on those tests? You know, did a lot of people go for the test?
It was a very good popular uptake because it allowed people to get out, it allowed them potentially to go and see relatives in
When's that likely to come back then?
Once we see the infection rate in the Northwest going down. But if I just finish the point about Dr. Glover, where she tweeted and said, well, there's other testing regimes, and I fully agree. And that's one of the things I think maybe we do need to consider. Do we test later, like day 10, day 12, if we're keeping 14
And there is talk elsewhere, isn't it, UK, maybe to make it 10? Did I read that somewhere?
So, well, no, they're considering potentially 7 days isolation instead of 14. Personally, I think that's a very big risk.
Yeah, I heard 10 somewhere, but there's so many things going around, isn't there?
There's so many that seems to be going on in the UK, but that's something that we could consider doing. But obviously, it couldn't be a charged for test, and it would still mean 14-day isolation. And the other risk you run is if you keep 7 day test in place, but people have got to do 14 days isolation, is although that might give you wonderful data, if someone's test comes back negative, human nature being what it is, I'm afraid it does increase the temptation to people to say, well, actually, I'm okay. I've got a negative test back. I don't necessarily have to keep to the rules for another 7 days.